So, good morning. I am so excited to be joined with two Cone Health employees that have agreed to spend some time with me today to talk about the Hispanic culture. I've been looking forward to this for weeks and just excited to have Raul and Carmen here with us today to talk about the Hispanic culture. So I'm going to kick us off and just kind of start with Raul and Carmen. If you all can just tell us briefly a little bit about who you are, where you work, and one thing that you love about your culture.
Good morning, everybody. Just tell you all a little bit about myself. So I am Raul Gomez. I'm currently with the emergency management team. I represent our system through a variety of ways that deal with specific to emergency management, everything from helping develop policies and procedures to education and training to actually responding to any type of real world events. Something that I really like about my culture, I think it's that sense of family and that sense of pride that is attached to the Hispanic culture.
Good morning, everyone. My name is Carmen Victor. I have been with Cone 7 years this August, so just celebrated an anniversary. I am currently the revenue cycle manager for outpatient rehab sites. I am housed in our largest facility, which is Church Street, and I oversee basically all that it is for an office operation. So from the beginning of when we receive a referral to the end process when a patient checks out. So everything that encompasses front office, I do have an immediate team of 9 individuals, but indirectly support all of our outpatient sites. We have 7 across the triad and continue to grow, have many more projects come in. So I'm excited to be part of a department that is just continuously evolving and growing and serving our community. What do I love about my culture? I love everything. But yes, if you know me, I love food. So I love our food. I love our diverse options of food. Interestingly, every Hispanic background country, right? Guatemala, Peru, El Salvador, Mexico, we all contribute to our uniqueness and bring a different flavor to the table. So that's what I love, our food and how diverse it is, just like our people.
Beautiful, beautiful. And you know what? I think we all can agree that we all love your food. It is delicious. And so we are so grateful to be able to experience that. Since you talked about food, Carmen, I think that we maybe can step into this. I thought about asking this a little bit later, but Cinco de Mayo, right? So we celebrate that here, and it's an opportunity that we go out, we drink, and all of that. Tell me what do you think about Cinco de Mayo? Should we be celebrating that? What Tell me a little bit about that.
Interestingly, I did a project on this when I was an undergrad at UNCG, because it was very important for me to find an opportunity in a space to bring awareness to what that day means to us from a cultural aspect. So Cinco de Mayo is the Battle of Puebla, in a region in Mexico, and it's not coming to me right now. But it's not our independence. Our independence is September the 16th, and the Battle of Puebla is just something that just led to that, right? So I personally, as a Mexican, I don't celebrate Cinco de Mayo.
Mhm.
I never heard of it until I was, embedded into the educational system in this country. And I was like, what is the big deal? I never understood. I would go home and my dad is like, I don't know what that is. So, but any opportunity that allows for us to have conversation and learn more about others, I'm open. So at one point, maybe I did not embrace it, but now I do because I love it when people acknowledge not only my culture, but my flag, my country, what we contribute to this country, the fact that we are here and are part and ingrained in the foundation of what makes up America. And so I just take an opportunity to just let them know, hey, I will go and celebrate it as well. I have done it before and will continue doing it again. Food brings us together. So I love the
Yeah.
awareness that it brings with it as well. So any
Okay.
opportunity that I have, I'll embrace it.
So I love that because, we're all learning and we all can sometimes jump on board with certain things and not really know the meaning. And since we're talking about misconceptions, I guess it would be, there's another thing that I really want us to dig into. And Raul, I'll start with you here, is that, over the last couple of years, we start hearing the word Latinx. And it's like we went from Hispanic to Latinx to Latino. So can you, Raul, help us a little bit learn about what is appropriate and what do you prefer, and help us so to make sure that we're respectful and using the right term.
That's a great question, and actually, we had a tremendous conversation about that when we were starting up our own internal group with Rachel and the rest of the members of really, what these terms mean in terms of Hispanic, Latino, Latinx. A lot of it just depends on the geographical region. Are you speaking the actual Spanish language? To me personally, I don't have a specific preference.
Yeah, so Latinx is very new to me. It's actually a term I um, learned about working for Cone Health. I am very transparent, um, and I said I don't understand the meaning of it.
Mhm.
Our whole language is very gender specific, right? So when you speak about females, las niñas, you know, and then man, los, somos, hombres, you know. So do I identify with this word? I don't. Um, from a cultural aspect, I think we still have a lot of grounds to cover, a lot of educating and introducing this to the community. Um, it's a term that I definitely see most of our elderly members in the community definitely not identifying, definitely not receiving of it.
Mhm.
Um, I don't know what that means.
Okay.
There's already a lot of confusion along where do we stand from a race
Mhm.
standpoint, from an ethnicity standpoint. I've had several conversations with several colleagues and peers that even though I've grown in the American education system, I had severe anxiety when it comes to identifying who I am and rebelled
Mhm.
against that because I never understood why I felt singled out. If you're Hispanic, circle this. If you're Mexican,
Mhm.
circle this. But where do I fall in the race category? So I feel like there's still a lot of learning within the
Yeah.
the Latino community.
Yeah.
Um, am I offended? No, I definitely once I learned why we did it, it's a way that we can gender neutral when we are talking to individuals. We again want to be inclusive and ensure that we're not leaving members of the community out. Me
Right.
personally, yo soy mexicana. I'm Mexican. That's how I identify. Am I gonna be like highly offended if you're Latinx or Hispanic? No, I'm not. Um, but if at any given time I need to have a conversation, I will have that conversation. And again, I'm huge in always creating that space and opportunity to help others understand how
Yeah.
I want to be referenced to or referred to or why I receive this in the way that I receive it. So yeah, this is a good question, Kiva,
Yeah.
because I still think within us in the Hispanic community, as Raul, correct me, but we still don't know.
Yeah, Carmen, I think you had a great point earlier where within, the Hispanic language, there's such a strong sense of masculine, feminine use of our vocabulary. And when you look at a term like Latinx, again, for me, my interpretation is it's to me, I think I see it as an effort to align with our current culture now, which is trying to address more of that diversity, inclusive
Mhm.
language, and that for the Hispanic worker, I think that's still that's a process and development because of it's so natural to say she, her, masculine,
Mhm.
feminine, and then when you start referring to a gender neutral, well, what does that really mean for me?
When we think about the inclusion networks, and both of you have mentioned that you're going to be starting a new network, which I'm extremely excited about. And the basis of that is around learning, right? And so, if you all wouldn't mind sharing, Raul, I'll start with you. Kind of tell us about your new inclusion network, and really what impact you're hoping to make.
I think one of the main goals that we're trying to focus on is kind of like a three-part approach. One is a internal development opportunity to to really start uh, highlighting um, the resources and the opportunities for minorities in general. Another area is to look at the service lines that we encompass, and how can we translate that to collaborate with our community. For example, I serve in emergency management. How can we better address and showcase to our community what we're doing outside of the Cone Health Network? And again, that doesn't necessarily specifically relate to our culture or our background, but I think it really does show the diversity that we bring as a group, and using what we do on our daily work basis to communicate with our community and show that, and then also use those times to uh, elaborate more about our culture.
What is the name of your inclusion network?
UNIDOS, that
UNIDOS. Okay.
translates to unified, right? Unity.
Okay.
And
Okay.
that is really at the core of this inclusion, like the rest of our inclusion group, um, currently active, like Launch and Bang, right?
Mm-hmm.
To bring that unity, that team effort that is definitely aligned with our culture and our I care values, and not just be representative of Hispanics, but us as a whole, and how can we come together, collaborate, and be here as a support and for our employees and in the community.
There again, it's an opportunity to come together, right? And so I think one of the misconceptions about the inclusion networks is that you have to identify with that
Right.
group in order to be a part of that group. And that is false. That is not true, because the
Mhm.
goal is to make sure that anybody can join, because it's about learning, and it's about helping our communities, and helping our organization to be more inclusive. So thank you all for that. So we're looking forward to getting that kicked off. Um, let's talk a little bit about healthcare and the Hispanic community. And, as we think about COVID, as that has shed a lot of light on some disparities that are present in not only the Hispanic culture, but in other underrepresented groups as well. And if you think about your family or think about you, what are some of the things that we could do differently to help the Hispanic community as it relates to getting healthcare access, or all of those things that we all need? Um, just tell me a little bit about that.
And I'll use for comparison purposes, I'll use what I currently do here within Cone Health,
Okay.
emergency management, because since I don't have a direct patient care
Here, yeah.
role, we have a indirect effect on our patient population here. So I think when you look at the services that emergency management does, there is tremendous research out there that also shows that those same underrepresented groups are some of the most severely affected when it comes to any type of, like disasters, issues like that. Those are the same people that are going to be your most vulnerable. Very similar to
Yeah.
healthcare in general. So, what are we really doing in terms of addressing that? It's very difficult from our perspective. Why? Because we work within that hospital system. What
Yeah.
we could do is through groups like what we're forming here, is to have those community opportunities to do outreach, to have conversations at your local church groups, at your local, like community groups. Have conversations such as, hey, what is a preparedness kit, for
Mhm.
example, right? Help
Yeah.
individuals with just basic needs like that can help mitigate some of those issues that would come up. And I think that has a direct correlation to their healthcare needs also.
So one of the things that really spoke to me when I was first um, a new hire at Cone is the awareness that we already have as an organization, right?
Mhm.
As we've identified these disparities and barriers that many of our patients face from a socioeconomic, gender, race, language, religion, background, and the things that have been implemented to support them and say we are here with you. And one of those things was our interpreting services, and the team that Erwin has, and they're phenomenal. And I that to me was great to see that every patient that's identified as non-English speaking gets that service. And it's not an additional charge. It's nothing that they have to go out their way to set up. It is already embedded within our EPIC registration format. If, front office team members who are the first in line, the first faces to encounter most of these patients, um, from a specialty primary care, um, even at our EDs, they have been trained. They do have this training in place so they can know what questions to ask and how to ask them.
Mhm.
Because again, we never want to jump into conclusions because you look a certain way, you need an interpreter, right? So,
Yeah.
so the ongoing conversations, training, and education that we have put into place, I take pride in that.
Hispanic Heritage Month is from September 15th to
Mhm.
October 15th. So I want to ask you all, who is one Hispanic from the past or present that more people need to be aware of?
Yeah, I think one of the individuals that just popped to my mind right now and had direct correlation to my family background, was Cesar Chavez, who was one of the leading supporters of the migrant farm worker movement in Southern California and all through California in general. Really fought for the workers' rights, equivalent to like what Martin Luther King stood for and his approach. The impact that individual and that movement had on countless families, including my own, has really um, shaped the direction of a lot of our lives. And I'll just give you all of my insight. So I'm a first generation Mexican American. Most of my parents actually worked in the migrant fields
Mhm.
as workers, and so did a lot of my aunts and uncles, grandpa. So and a lot of family friends did that too. We weren't part of the rotating families that used to follow the crops and all that, but I know people that actually did, and
Yeah.
it's a very hard life, but when you reflect back on what that movement tried to do to really provide the best opportunities for the worker, that had a direct effect on those children.
I have been part of conversations with the Hispanic Coalition in Greensboro, and I'm just amazed by what we're doing here locally. And I think if I haven't gained anything is to continue using my voice,
Mhm.
um, and hopefully a voice that resembles what has already been laid way
Mhm.
before me, and what I've learned from every individual, past, present, and in the near future, um, and to say, this is who we are, we're here, and we too have a voice, and we want to be heard, and we're not taking anything from anyone. Instead, we want to come here collectively to work together and continue building on this great, great nation, and we're empowered to do so.
When I think about UNIDOS, I think that that's going to be a prime opportunity for people to learn and for people to get involved and to really continue to let their voice be heard. And so I'm actually going to be the executive sponsor for UNIDOS. And so I'm really excited to be a part and learn and be able to help move us forward, right? Because that's what it's all about. It's about progress, and making sure that we're all in this together and we're all right here for each other. And so I'm really, really excited about that. So before we wrap up, is there any one thing that we did not talk about that you would like to talk about? Is there any question that I did not ask or anything that you want people to know about the Hispanic culture that we did not touch on?
The only comment that I would have is, and again, this is just my perspective, is I would like individuals to understand that we're not just one culture, especially growing up being raised here in the States. You really encompass a variety of cultures, and I think um, trying to get folks to understand that we we almost fall on different sides of the play, right? Or where you have to adapt to the Mexican Hispanic culture if you're in the States, but then if you travel to Mexico, it's a complete different environment. There's also an environment, here within Cone Health, right? That and just to try to understand that sometimes it's not as easy as it might look for
Yeah.
a lot of us because we have to have this balance, and but at the same time I think that's a tremendous advantage for us and any individuals that have representation across different cultures and backgrounds, because I just think it really brings to that perspective of our entire view.
Mhm. I love that. I love that because we're not just one dimensional, right? And so getting people to understand that we're all multicultural in a way, right? And so I like that, and just to make sure that we're paying attention to that.
All my fellow Hispanics, Latinos, Latinas, Latinx of Cone Health, share your story. Um, I think a lot of us, I know I did, I hid behind all of those layers of, you know, who I am as a Latina woman, as a Mexican woman, as a first generation immigrant. Um, and, you know, while yes, we have every intention to check our feelings and emotions at the door before we step in to this realm and provide the best version of ourselves for our patients, we're still humans. And a lot has happened in the last, you know, 3 to 5 years. And maybe to me is more relevant because now I'm an adult. I see things very differently than when I was a child and realized how sheltered my parents kept me.
Mhm.
Um, but what is going on in our country, in the world, it's impacting all of us.
Yeah.
And I love, Kiva, the work that you have done from your department and and the initiative and our CEO creating the safe space to say, we're here for you. We're here to support you. This is a safe space.
Mhm.
So I encourage each and one of you at any given time, to find that one person, because I'm sure there's one person within the organization that you can talk to and just let you be and share your story because there's a lot of things going, especially with our immigration system.
Yeah.
There's a lot of things that are being terms that are being flown at us, and you know, um, we're not bad people. We're not one dimensional. We're not, and if we also very tough skin community,
Yeah.
you know, but we do have our soft spot. So I encourage everyone to speak to your story.
And when we think about the word ally, right? We've heard that term floated around and people use it. It's a verb, right? It's about action. And so, as we're joining different network groups and learning, it's about standing up for the underrepresented, and we take that personally and want to do that. So you can't be an ally and not do anything. That's not an ally does things right and takes action. You all have been phenomenal. I have truly enjoyed learning more about the Hispanic culture, learning more about you, and just excited about where Cone Health is going and where we will continue to go and the progress that we've made and the journey that we're on. So it's going to take all of us, right? It's going to take all of us to make sure we're providing a space that's safe, a space that's equitable and inclusive. And you all are right on the front lines of that. And so I just want to thank you for that, and just know that you're appreciated, and we are happy that you are here and happy to be on this journey with you all.